Well, you will likely notice a lot of red again tomorrow, and it's all for raising awareness about the #1 killer of women. Lisa Hawker is with us this afternoon. She's the chair for the Go Red for Women campaign. A pleasure to have you today.
Thanks for having me.
Yeah, I just wanted to match.
Yeah, well, it's perfect.
It is, and I have plenty more red, so I'll have red for tomorrow as well. This is a way to raise awareness about heart disease, and what made you decide that you wanted to take on this challenge of sitting as the chair this year?
Yeah, it's a great question. So, quite frankly, when I was asked to take on the position, I really didn't know that much about heart health. I really hadn't experienced it in my life. And so as I started to think about it more and started to meet people and even recruiting for our executive leadership team, the stories from women and how prevalent it is. It's more prevalent than all forms of cancer. So it is the #1 killer of women. And for that, we take care of everybody else. And so we need times to just take care of ourselves.
Isn't that the truth?
Absolutely.
What do you need? What do you need? What do you,
Yep.
Wait a second, what do I need?
Yeah.
we do need to take that moment. And yeah, 45% of women over 20 are going to experience some form of heart disease. That's a wild number.
It's a wild number. And the thing is, it's all much more preventable than a lot of things. So if we take care of ourselves, if we take care of our stress levels, if we eat a little healthier, if we get the rest we need, all the things that, quite frankly, we just normally don't do.
Yeah, there's women out there going, sleep?
Yeah.
What? How am I supposed to squeeze that into my day? But it can make a difference. It really can, as you said, preventable. So what has this year been like for you? I know even just this morning you were pretty busy doing something.
We had a great opportunity this morning to partner up with the YWCA and provide them with CPR kits. These are CPR kits that can be reused, and the YWCA does such a great service here. And so to be able to teach hands-only CPR to their residents, and that those individuals can then take that as they continue to branch out, get their lives back together, they're going to know that, and they're going to be able to take care of themselves and their families. So the morning started off pretty crazy. The year has been really fun. Like, that was the goal. We can raise money, we can raise awareness. We're gonna have a lot of people sitting at our event coming up. But the biggest thing that I told the whole group was, we're gonna have a lot of fun, and that's what we have done. And when you have fun, you raise money.
Yeah, and you've done some significant fundraising. What does that mean to you to look at this number? What is it, a
$250,000 goal? And they had a record-breaking event last year. So coming into that with such a great group of individuals, it was a little scary,
no pressure.
to be honest. Yeah, right. But we are actually already at our goal. So we've raised the goal for ourselves and put a couple of additional metrics on, like we want to have 500 people at our event this year. And so, it is easy when you're having fun. I wanted everybody to bring personal joy to this, to be able to really network and get to know each other. And, we've become really good friends through it all, too.
It's wonderful. And that support can really make a difference in someone's life as well. You mentioned the event you have coming up, and that is the luncheon coming up at the end of the month. Yep. And you do have some tickets available for that.
We do. People can still get tickets if they go to the website, but it is selling out quickly.
Yeah.
It's going to be a sea of red. I just can't wait to see everybody in their red. They're supporting women's health. In fact, my husband has kind of gotten into the cause, because generally it's a very female-centric event, as you can imagine. So he's doing Bros Go Red.
Okay.
So they are going to have a couple of great tables with men in their red ties, supporting their wives, their sisters, their mothers, to go red for women.
Yeah. Have you noticed changes in yourself this year in terms of how you are taking care of yourself? This is probably taking a lot of your time, right?
Yeah, it does, but I'd love to say yes, but that's probably the thing that, again, we need to know about. I will say, though, in terms of just heart health, learning a little bit more about it, learning the signs that people a lot of times don't realize, that actually things like heart attack and stroke present very differently in women than they do in men. So that type of awareness, if we can continue to get that word out, if we can continue to support each other and say, okay, Amanda, it's time to take a break, it's time to get some sleep, it's time to take care of you, I think that's what we all need to do. And heart health is the rest of health, quite frankly.
Absolutely, right. So if you haven't been to the doctor in a little bit, you don't know your numbers, maybe now is the time to see how that blood pressure is looking, how all of that, hey, maybe you're good. Hey, wonderful, wouldn't you want to know that? But you also want to know it if maybe you have some work to do to get those numbers down. But as you said, it is preventable. So maybe it's just going out for a walk.
It
on
is.
lunch break or just getting moving.
All that movement, getting good rest. It's amazing, how sleep deprivation and, for individuals who are childbearing years, making sure that as they're growing their child, that they're also taking care of themselves in a lot of different ways. So knowing your numbers, getting a little exercise, getting the right amount of sleep, eating healthier. I mean, that's the other thing. We're always on the go.
On the go.
So you're on the go. And what do? You grab
go through the
the
drive-thru.
least healthy thing possible. So, and simple things like drinking enough water, all the stuff that we always forget to do.
Yeah, so we're just raising that awareness now. So make sure you get in the closet, maybe do it right now during this commercial break. Pick out that red outfit that you're going to wear tomorrow, and then just talk to the women in your life and say, "How you doing? How's you taking care of yourself?" Yeah, that's what we need to do right now for one another.
Absolutely,
Yeah.
absolutely.
Thanks for being here today and
Thanks,
for all the
Amanda.
work you've done this year. We
Really appreciate it.